Hello, my name is Erin Callahan from Brandman University, and I'm going to walk you through my professional growth plan as an NP. My personal philosophy and current strengths are actually the reason why I became a nurse and the reason why I want to become a nurse practitioner, and that's that I am at the heart a people person. I love speaking with people, learning about them, and just having that human connection. That is something that I've always had in me and I love to do and fulfills me. My personal philosophy will be to provide the best possible care I can to my patients, and for my patients to know that they're being heard and that they're respected. My ultimate dream and personal vision is to one day own my own practice. I would love to have a wellness center that is small family practice, but it's also comprehensive, and I would provide medical services as well as wellness. I would like to do yoga classes there on the weekends, have somebody that comes in on certain days to do acupuncture treatments. I would also like to have some small list of cosmetic services as well, such as laser hair removal or maybe cryosurgical services. My personal mission would be to provide whole person centered care that focuses on illness prevention first and foremost, but also healthy living and management of acute and chronic illnesses across the lifespan. I have many ideas and plans of how I want to keep current with my credentials and certifications, and one of them is that within the first 3 years of me practicing, since I won't be owning my own practice in the first several years, I will just be getting experience. So during that time, I want to take advantage and attend as many courses and conferences as possible to really enhance my credentials and my skill set. I would like to maybe register for at least one a year. I found a website called Medical Education Research, and they have links to all kinds of conferences that are held every year, multiple times throughout the year in different locations with different topics. So one that piqued my interest was dermatology and primary care. They also have women's health and addiction services, things like this. So things that are all centered in primary care and on topics that I would be seeing in my practice. So during these conferences, I would also be able to network, and that's another part of expanding my knowledge and broadening my professional horizons, is to network with other providers and other family practices to see what they're doing in their settings. This is the website for this particular company that provides links to all these several conferences. My plan to broaden my expertise and credentials would be to also attend as many certification courses after getting my NP as possible. So some examples that I found and that were recommended to me by other nurse practitioners was an ultrasound certification course where they teach you the basics of ultrasounding, so you can use it in the primary care setting to help diagnose things, to help see if there's fluid buildup in certain areas, and it's a way to kind of steer your diagnosis and your referrals and things like that. So I think it would add a lot to my practice. So I would love to get certified in that. The course is $625, and I found a website where it's offered in my area. Another thing that I would like to get certified in is laser hair removal. The practice that I'm working in now, she has a couple rooms on the other side of the building where she does this type of treatment, and she also will remove skin tags and things like that. So she does both the family practice and she does some of the cosmetic stuff as well. And there seems to be a huge need for that. There's lots of patients that come in requesting these types of services. The other type of thing I would love to get certified in is cryosurgical procedures. So freezing off warts, freezing off skin tags, simple skin lesions, also learning how to do small biopsies and some simple, not too complex electrosurgical procedures. I found a course through a program that is a little bit pricey. It's $1,100 for 3 days, but it teaches you many different things, and I think it could be useful in my primary care setting. Other things that I could do is to implement process improvement ideas in my setting. Again, with networking with other providers in primary care, I could learn, across the country what people are doing, what kind of trends people are doing in primary care to make their practices successful, and learn from that and try to implement it in my own setting. If I'm able to get something that works really well in my local area, I could publish it in a newsletter or an article or a journal and get others involved in that as well. I could also get involved at the local level in the community with certain healthcare trends. If we're seeing certain outbreaks of things or rises in certain STDs or anything that I think is concerning that I'm seeing in the clinic, I could go to the local churches, or I could go to the high school and, just give a talk and educate to help curb some things that are happening in my community. How I relax and have fun. Well, how I unwind and relax is at the end of a busy day, I like to come home and have a glass of wine and just enjoy my home, whether it be gardening or taking care of the animals. I do have quite a few pets, and I would love to one day have horses, and that would be something that would be my unwinding and relaxing every day, is just doing things like that in my home. And then also going on trips and traveling when I have the time. Identifying needed resources to attain a balanced life. I think that would just basically be my family and my friends. They are my support system. They are what gets me up, keeps me going, and without them, I wouldn't be able to accomplish all the things that I need to accomplish. Essentials for personal fulfillment. I think just making sure that I have enough sleep every night and making sure that I always give myself a few days off each week so that I can unwind and let loose and kind of recover from the work week. My plan for how I want to integrate personal fulfillment, health, and the needs into the demands of my practice. Well, I'll do this by making sure that I take time to slowly build my practice and not expect to take on so much all at once. As I slowly build from something small, I can start to add on another NP or another provider or another service and build my practice slowly. Once I get to a certain level, I would hope that my practice would be able to kind of run itself, and I can therefore have more time to do other things and just be able to check in on the practice and work on the days that I want to and see the kind of patients that I want to see. That is my ultimate goal. What can be sacrificed if necessary without sacrificing my personal mission or vision? If I have to, I'm okay with sacrificing working full-time and earning that full-time salary, because it's not all about the money. It's about my sanity and my health and spending time with my family. So if I have to, I will only work 2 or 3 days a week and, maybe work from home on the other days so I can be home with my family and make sure I have time off if I need it.